Hi, I'm Betsy Nicoletti. Would it surprise you to learn that coding for medical practice services is complicated and open to interpretation? Although practitioners, administrators, coders, and billers all have different priorities in the practice, everyone wants the same thing ultimately, to get paid all of the money that the practice is entitled to collect, but to minimize their compliance risk due to coding. The problem is coders can feel frustrated between a rock and a hard place. They're looking for source citations and get tired of everybody's opinions about things. The mission of CodingIntel is to provide just that, resources that are up to date and based on source citations. A membership in our site can take you from frustrated and uncertain to satisfied and certainty. How do we do that? We research CPT and ICD-10 rules and Medicare policies, and we synthesize those and interpret them and put them into the kind of resources that you can use in your practice to help with your coding decisions. So we don't just take what's written on the CMS website and copy it onto our site. We interpret those policies. They're both in-depth guides. So we have some coding guides that are 20 or 40 pages long, probably more than some people want to read. And then we have quick reference sheets for when you just need that quick research, that quick resource. We have monthly webinars, and we of course record those, and those are available online for on demand. And we keep the resources updated. So in prior years, we would update things every year. Of course, in the last few years, we've had to update our resources more frequently than that, and we've done that. So as CPT or Medicare changed their rules, and usually in the mid-years, we've updated things. Is CodingIntel for everyone? It is not. If you're looking for a Q&A forum, you're not going to find it on CodingIntel. We don't have lookup tools for CPT or NCCI, and you're not going to find out how to code for that invasive cardiac procedure. It isn't a consulting service. What you will find, though, are curated resources that interpret these complex rules and provide you with the resources that you need in your practice. If you bill E&M services, we've got you covered. What category of service, what level of service, inpatient services, outpatient services, care management, all of those lovely codes that have been added to the front of the CPT book for care management, remote monitoring, interprofessional consult, online digital. We've got resources, short videos, and articles about those. So we have a lot of E&M information, so that covers many specialties, and then information about the global surgical package, use of modifiers, how to code certain minor surgical procedures, preventive medicine services. We have a lot of information for some specialties: primary care, behavioral health, dermatology, general surgery, and FQHCs. If you struggle to find answers, CodingIntel's library of definitive, easy-to-use resources and online webinars is going to make you a hero in your practice, because you're going to have the information at your fingertips. Over the past 25 years, I have visited hundreds of practices and spoken to thousands of people in person and, of course, in this way. I wish I could come to your practice and answer all of your questions individually, but a membership in CodingIntel is the next best thing. I've created this citation-based library, which you can access in full with your membership. So go to codingintel.com and join today.